Good afternoon, everybody. My name's Mike O'Connor. I am here on behalf of GenetWorks. We are the sponsor of Clinical Practices and Memory Care Track 1. I'll talk very briefly about GenetWorks. We do have a booth upstairs. We are a nationwide molecular diagnostic laboratory. So in communities, assisted living communities and so forth, I typically start with urinary tract infections, where we can help with the diagnosis and reporting. But we also serve pharmacogenomics, pharmacogenetics testing as well, where test for drug-on-drug interactions and also individual on how each person can interact with their medications. We can also be a full-service laboratory. Again, GenetWorks, we are upstairs, and the cookies that are on the tray are homemade, made by me. Feel free to stop by. So I am excited to introduce our speaker for this next session, Dr. Rayna Letourneau, and she is the Interim Executive Director of the Florida Center for Nursing, as well as Assistant Professor at the University of South Florida College of Nursing, and the Founding Director of the USF College of Nursing's Office of Wires. She has 20 years of nursing experience. You don't look old enough to have that, but I'm going to trust you.
In kindergarten, I started nursing school.
Yes, she has 20 years of nursing experience with a clinical background in emergency nursing in New England and 13 years of undergraduate and graduate nursing and interprofessional teaching experience in Rhode Island, Massachusetts, and in Florida. Dr. Letourneau has made it her work's purpose to create a highly educated, competent nursing workforce and advance the impact of nursing on the health and wellness of our nation. Her scholarship focuses on nursing workforce development, transition to practice, nurses' health and wellness, and quality and safety education for nurses. Thank you for being here today, Dr. Letourneau. The floor is yours.
Thank you, Mike, for that introduction.
Sure.
Very much.
Okay, thank you all for coming, and thank you again for the introduction. I was asked to use the microphone, even though it's a small group, so we are being recorded, and that's why. So welcome to this session, Wellness Innovation Support for the Nursing Workforce. As Mike introduced me, I am Rayna Letourneau. I've been the Interim Executive Director for the Florida Center for Nursing since November of 2021, and I've been with University of South Florida since 2019. Our objectives for our session today are to outline the components of well-being. So we're going to talk about well-being, wellness, and innovation, and we're going to identify well-being programs that are being offered to nursing students which aim at increasing resiliency, and also identify well-being programs that are being offered for nurses aimed to reduce burnout. So before I begin and get into all of the well-being and program information and content, I'd like to just tell you a little bit about USF. So I do bring you greetings from the University of South Florida. And for the Floridians in here, you may be saying, well, South Florida is in the West Central region and not South Florida, and you are correct. So just where that star is, we are actually in the West Central region. When USF was founded, I was told that it was the southernmost public university, and so that's why it was named University of South Florida, which is pretty interesting. A little bit about the College of Nursing here, and let's look at my notes to make sure that I don't misspeak on the year that we were established, but the University of South Florida was founded in 1973. The College of Nursing was founded in 1973, and we're one of 14 colleges across the University of South Florida. We have 3 campuses in Tampa, St. Petersburg, and Sarasota, Manatee. University of South Florida and the Tampa campus specifically has been designated as a preeminent state research university. We're one of the nation's top public research university campuses. And then talking about the University of South Florida College of Nursing, we are an integral piece of USF Health and part of the University of South Florida. And some of our points of pride you see here on our slide. We are a diverse program with a large enrollment, almost 2,000 undergraduate and graduate nursing students. We really boast our licensure and certification pass rates. So in 2021, our pre-licensure students who had to take the NCLEX examination demonstrated a pass rate of 91%, which is much above our state and national average. So we're really proud about that, and our nurse practitioner certifications at 92.1% pass rate. Then I'd like to talk to you a little bit about the Florida Center for Nursing. So the Florida Center for Nursing had been defunded and dissolved in 2020. So the work of the center had abruptly stopped. The work of the center is really important, and I'll go into in the next slide what we're charged with by the state statute. But I just wanted to tell you a little bit about the efforts to get the center reestablished. Because after there was no funding and that year of no work from the center, we really understood in our state the importance and the need for this data and the need for this work. So the Florida Nurses Association started a grassroots campaign, and many of you may have heard about that or even participated in it, where their members really went to the representatives and explained the importance of the center for nursing and for our healthcare industry. And so in 2021, the Florida Nurses Association was funded to reestablish the Florida Center for Nursing. In 2022, the Florida Center has continued to be funded, and the funding will allow the Florida Center to be housed at the University of South Florida. So what exactly does the Florida Center for Nursing do? So it is a state workforce center. It's established by our state statute, and it addresses the issues of the supply and the demand of nursing. Really what we're charged for is developing a statewide plan for our nursing workforce, making sure that we're going to identify if there is an imbalance in the supply and the demand, and then make some recommendations on how to correct the imbalance. We are developing recommendations on increasing nurse faculty, increasing preceptors, helping to advance that pipeline of nurses into our workforce, developing best practices for academic preparation and continuing education for nurse educators. And really, we're charged also with enhancing and promoting the recognition, reward, and renewal activities for nurses. And we think that this is really important also, both for the pipeline and letting people understand what nursing is, how valuable it is to our healthcare industry, but also for retention and making sure that nurses are appreciated and valued and understood as the important part of the healthcare team. The Florida Center for Nursing is a member of the National Forum of State Nursing Workforce Centers. And this is really important at the national level to make sure that Florida has a seat and a voice nationally. And the interim executive director, myself, I serve on the research committee for the National Forum. Recently in June, I was invited to be a panelist at their conference and speaking about why it's so important for us to have this data and to be able to use the data to make data-driven decisions and how we're going to allocate our resources and make recommendations based on our data. I was also selected to collaborate on the National Council of State Boards of Nursing's National Workforce Survey along with 3 other states. So we do a biannual nursing workforce survey. So Florida will be represented there. So that gives you a little bit of a background of the University of South Florida College of Nursing and the Florida Center for Nursing and what we do and what we're charged with. So now we're going to go into our problem and identifying what is our problem. And I think we probably all know already that COVID-19 has impacted a nursing workforce that was faced with widespread stress, health and wellness problems, burnout, depression, and increased rates of suicide. Now, I say that these are problems that are impacting our nursing workforce, but it also impacts our interprofessional colleagues. We know, and there's much evidence that shows physicians, so our colleagues in medicine, our colleagues in pharmacy, our colleagues in respiratory therapy, we could go on, but our healthcare workforce is having a lot of trouble. So prior to the pandemic, we have evidence in nursing from the American Nurses Association, Healthy Nurse, Healthy Nation, that nurses are not a healthy group. So we know that compared to the average American, nurses have higher BMIs, get less sleep, higher anxiety, higher depression, all the bad things, right, that And there's a disconnect because nurses know about health and wellness, and we teach our patients about health and wellness, and we teach communities about being healthy and being well. But yet nurses don't practice it ourselves, and I'm generalizing here, but as a group, nurses are typically not as healthy as the average Americans. And we do have data from the American Nurses Association that says 68% of nurses typically put the needs of others and the needs of their patients ahead of themselves. And that's an important factor to consider as we're looking at the health and wellness and the well-being of our nursing workforce. These are nurses typically put everybody else's needs ahead of themselves. So that kind of, I think, provides some rationale on why nurses are not as healthy as the average American in almost every health indicator. Now, when we had the COVID-19 pandemic, we just exacerbated all of these problems. I also wanted to mention the National Academy of Medicine's Future of Nursing 2020-2030 report as part of this background too. So the National Academy of Medicine's Future of Nursing report, the previous one 10 years ago, was providing recommendations on how we can advance nursing and how nurses can be valuable and what they need to do. And with the Future of Nursing 2020-2030 report, I put this up here because the National Academy of Medicine is identifying the key areas that nurses need to focus on to be able to impact determinants of health and improve health equity and healthcare equity. And so if we look at the key areas right here for strengthening nursing, the National Academy of Medicine recommends focusing on the workforce, so workforce development, focusing on leadership, education, well-being, and emergency preparation and response. So now I'd like to really talk about well-being. So there are the definition here on the slide, well-being. I'm not going to read it to you, you could read it, but I did make a couple notes that I wanted to make sure that I didn't forget to mention. Pardon me. You said I looked so young when you introduced me, but my eyes needed to make this a little bit bigger so I could read it. Okay, so I did want to tell you that we do have evidence that demonstrates nurse well-being is essential for safe, high-quality patient care. Some of the research that comes from Ohio State University and Bernadette Melnick identifies specifically to critical care nurses that their health and well-being is directly related to patient safety. So there is evidence that there was a study that demonstrated critical care nurses who had increased rates of depression or scored higher on the depression scales were more likely to make medication errors. So there's definitely well-being is linked to patient safety, and we need to focus on that. But nurses are experiencing alarming rates of burnout, which we need to focus on. And burnout, we know, is a syndrome characterized by a high degree of emotional exhaustion and depersonalization, and also a low sense of personal accomplishment at work. And so you hear a lot about burnout in literature right now, even in mainstream media. Nurses are burned out, healthcare workers are burned out, but we also need to make sure that we're focusing on well-being. And well-being supports improving patient-clinician relationships, promoting a high-functioning care team, and an engaged and effective workforce. So more work from the National Academy of Medicine. Here on the slide, you're looking at the framework that they provide for clinician well-being and resilience. So in 2017, the National Academy of Medicine launched the Action Collaborative on Clinician Wellbeing and Resilience. And this collaborative is committed to reversing the trends in clinician burnout. Their collaborative has 3 goals. Number 1 is to raise the visibility of clinician anxiety, burnout, depression, stress, and suicide. So raising the awareness, letting people know it is a problem, because we really can't address it until we understand that the problem does exist. Goal number 2 is to improve baseline understanding of challenges to clinician well-being. So understanding why are clinicians not well, and going back to that statement that I was saying, 68% of nurses identify putting needs of others ahead of themselves. So maybe that could be one of the challenges to well-being. And goal number 3 is to advance evidence-based multidisciplinary solutions to improve patient care by caring for the caregiver. If we understand these factors that are on the outer edges of this framework and how they impact clinician well-being, and then realizing that there's a relationship from the clinician well-being and their relationships and how that's going to impact patient well-being, I think that we have really important work to do to make sure that we keep our patients safe. So now we've spoken about the problem and some of the background, and now I'd like to say, what are we going to do about that, right? So this is really probably why you're here. What are some programs that we're implementing with the Florida Center for Nursing and University of South Florida for nursing students and for nurses that will focus on their well-being? So in my introduction, it was mentioned that I'm founding director of the USF College of Nursing's Office of WIRES. And you may say, what is that? I've never heard of it. So during the pandemic, we were at the College of Nursing, we were doing some work in literature and investigating burnout, investigating moral distress, investigating compassion fatigue, investigating nurses leaving the workforce, investigating nurses being exposed to COVID-19 and diagnosed at a higher rate and dying at a higher rate than other people in the community. And we were saying, what could we do at the college to help, to make improvements, to continue our study and to have some interventions? And so I don't know why that, it looks a little weird here, so it might have been a different version of PowerPoint when I sent it, so pardon the weirdness on that font. But our Office of WIRES is an acronym. It stands for Wellness, Innovation, Resources, Education, and Support for the Healthcare Workforce. And yes, we are a College of Nursing, but we think and we know that a lot of our problems with well-being in the nursing workforce transcend our interdisciplinary partners. And so we as nurses can lead this wellness and innovation and resources and then extend it to all of our healthcare workforce. So the College of Nursing's Office of WIRES strives to create a healthy, highly educated, competent, and empowered healthcare workforce that will advance the well-being of our communities. And we define communities both at the local, state, regional, and national levels, and even global community. So we look at recruitment, retention, and well-being. And here I have this kind of as a Venn diagram. There's overlapping. You can't really focus on just one without it having an impact on all the other areas. So you may have been hearing a lot about the nursing shortage and how are we going to solve the nursing shortage? And people may say, well, just produce more nurses, right? What's that? Have more nurses come into the nursing schools. And that would be a great recruitment. However, that's not going to solve any imbalance. We all know once we recruit these nurses or prepare or increase that pipeline into the workforce, what are we going to do to make sure that we can retain them in the workforce? What are we going to do to make sure that they have a successful career that lasts longer than what we're seeing right now with some early retirements? And we need to really focus on the well-being of our healthcare workers, our healthcare providers, caring for the caregiver. And that's going to help people want to continue to be a healthcare worker or want to be a nurse and then stay in nursing. So the first program that we initiated from the College of Nursing Office of WIRES was our Frontline Nursing Continuing Education Program. And this program was available from January 2021 through January of 2022. We received philanthropic support to be able to develop, offer this program, and offer CEUs for free to any nurses who participated. So that was because of our philanthropic support. So this continuing education program was a webinar series. It was a 4-part webinar series. And nurses could access it was asynchronous, so they can access at any time that they had internet service and had about an hour to watch a webinar. The 4 webinars were not prerequisite. None was prerequisite to the other. So if a nurse just wanted to take the 4th one, the nurse could watch the 4th webinar. If they wanted to do all 4, they could watch all 4. So they could earn up to 4 CEUs, continuing education units, for completion of the program. We did disseminate this information at what you see here on the screen. I don't expect you to actually read that, but it's just demonstrating that we did have a poster presentation so we could disseminate the work that we did. And this poster was presented at Sigma's Creating Healthy Work Environments conference in Washington, D.C. in March, I believe it was, in 2022. And we also have a manuscript that's being reviewed right now for the Journal of Nursing, Continuing Education in Nursing. So we did want to disseminate this, this project because it was at a time that nurses were identifying they needed more education to help keep them safe. So these webinars went more than, it taught nurses how to keep themselves safe, but more than just hand washing, masking, social distancing. It really talked about empowerment and advocacy. And one of the webinars, my favorite title was, No, It's Not Okay to Wear a Trash Bag, or, because we were experiencing things that probably nobody ever thought we would experience in healthcare. And nurses didn't know what to do. And they were challenged because protocols were changing just about daily. So we created the continuing education program, and our outcomes, we had more than 1,000 participants from 8 different countries, and 995 CEUs were issued to nurses. So we were pretty proud about that, and we think that that was helpful to our community, helpful to our workforce, but we know that the conversation needed to continue. We couldn't be done just with those 4 asynchronous webinars that were recorded prior to 2021 because we launched in January 2021. So we also have a frontline nursing podcast. And our podcast has monthly episodes, but in full transparency, we haven't published in, I'm going on my 2nd month now, I think, of no publishing. So pardon me, with the end of the fiscal year in the Florida Center for Nursing needed some of my attention, and I didn't have time to publish the podcast for the last month. However, prior to that, we had monthly podcast episodes so the conversation could continue. We could talk about strategies that nurses use, what works well for them, so listeners can decide, hey, maybe I'll try that, or I feel the same way. Similar experiences have happened to me too, so it validates for nurses that they're not alone when they're experiencing problems or challenges, and then identifies some possible solutions for them. So our first year of the Frontline Nursing podcast had more than 3,000 downloads, and listeners were in 48 countries and territories. So in full disclosure, 90% of the downloads came from North America. However, we do have global downloads, which is pretty exciting. Then I would like to move on to the Excellence in Nursing Wellbeing Coaching Program and talk to you about this a bit. So the Excellence in Nursing Wellbeing Coaching Program is an academic practice partnership between University of South Florida College of Nursing and Sarasota Memorial Healthcare System. Sarasota Memorial Healthcare System is one of our clinical affiliates where we would send our nursing students for their practicum rotations and their clinical courses. But we thought that there was an opportunity to build a partnership that's a true academic practice partnership, more than just a clinical affiliation. And what I mean by a true academic practice partnership is as defined by the American Association of Colleges of Nurses, or AACN, where a true academic practice partnership has obviously academia and practice coming together, sharing their resources because they have a shared vision and shared mutual goals. And that's what we had right now. So when Sarasota and USF came together, we identified we had a shared problem. There was the organization was experiencing what they classified as COVID-related departures, and what you all may have experienced, where nurses were leaving at a higher rate than we anticipated. Nurses were leaving, and they had many different reasons. They were leaving because they were afraid and they didn't want to take care of COVID patients. They were leaving because they were taking travel assignments. They were leaving because everything closed down and they might not have had childcare. Like all the reasons that people were leaving. And now it was a problem for the schools of nursing also, because we need nurses in the hospital settings to help train our students and to help care for our communities. So we identified that there's an opportunity to come together and build a program which we titled Excellence in Nursing. We did receive philanthropic and foundation funding for this program, and we've piloted. So the Excellence in Nursing program has two branches actually, because if you remember when I was talking about the Office of Wires, you can't focus just on recruitment or retention or well-being. It's really looking at all of the things together, and that's what we're doing with this program. So the first branch of the program is focused on the well-being of our student nurses and our nurses at Sarasota Memorial Hospital. And we offer a well-being coaching program. So we are testing the feasibility and acceptability of this program. The goals of the program are to increase well-being, increase resiliency, increase mindfulness, decrease burnout, and decrease the intent to leave, which is important. So we did enroll our first group of students back in January into, we were offering the students a 6-month well-being coaching program. And so the first cohort that started in January are finishing this week. So I'm really excited to be able to look at that data and report back. But preliminary data from the students show that yes, this program is accepted by the students. They absolutely want to do it. They think that every student should do it. The feasibility, I think that I can't wait to look at the data and really investigate what that looks like and what all the processes look like. Because right now, some of my concern is that the students want to participate. They think it's a great program. It has good content. But unless it's part of their curriculum, they might not have the extra time to do so. Similar to what we're going to know with our nurses too. They know they should do things for health and wellness. However, they always can't. There's not always the opportunity to do so. So we'll see about that, and I'll report back, I hope, at next conference or sooner. But again, with that pilot program, the Excellence in Nursing Wellbeing Coaching, the student cohort is ending, and our nurse cohort for the pilot program will begin in the fall. And we're looking at what's their baseline level of well-being for both students and the nurses. But really with looking at the student nurses, will this program improve academic outcomes? Will it facilitate their transition into the professional practice environment? Is it going to impact recruitment and retention? And then with the nurses, we're looking at key concepts of burnout, retention, turnover, looking at mindfulness and resiliency too. So the Excellence in Nursing program I mentioned had two branches. One branch we're looking at that well-being of our nursing students and our nurses, and we're offering the well-being coaching program. The other branch is really focusing on that pipeline into the professional practice setting. And we have the preceptorship to hire program. The preceptorship to hire program. Let me give you the background of the curriculum at University of South Florida College of Nursing, and it matches a lot of pre-licensure programs across the nation, where the nursing students' final semester in college, they have an experiential learning course, which we titled Preceptorship, and they're matched one-to-one with a registered nurse in the clinical setting. Now, typically, they would be matched one-to-one in a clinical setting wherever their clinical group goes. So if Sarasota Memorial Hospital was their clinical site, they would find a nurse within Sarasota, and that's where you do your things. But I thought there was an opportunity here to really be a little bit more mindful and more intentful, purposeful maybe would be the better word to use, about where we're placing the students for that last final semester. And developing a preceptorship to hire program, which allows the students to have some say into where that last clinical placement is going to be. So if a student knew that they had the desire to work in a critical care environment, then maybe we should try and match them with an RN in the critical care environment during that last semester. Or if they knew emergency, or maybe they know it's not hospital-based setting, which will be phase 2 of the preceptorship to hire program. But the overall purpose of this is to facilitate the nursing the nursing students transition from academia into professional practice, and our intent is to give them exposure to the unit that they're going to work before they actually come as a new nurse. So we know that new nurses have a higher than normal turnover rate within 1 year, and depending on the literature source, it can be as high as 50%. And some of that is because the nursing students don't really know what they're getting into. They don't know what they don't know. And a lot of the nursing students, I joke, so please bear with me of this joke, but sometimes nursing students come into my classroom and they're like, Dr. Letourneau, I know I want to be a NICU nurse, a neonatal intensive care. Since the day I was born, I knew I wanted to be a NICU nurse. But maybe they've never been in a NICU, or they don't really understand what a complex healthcare organization is or offers. So when they get to that NICU as a new nurse, that's sometimes when they realize this is not what I wanted to do. And that can increase to the turnover rate at the new grads. So this program is really giving them that exposure, that ability not only to learn the patient population that they think they want to learn, but learn the unit, learn the culture on the unit, and see if they're really a good fit. So all of those things are what we're doing with this. Our goals for the Preceptorship to Hire program is to recruit baccalaureate prepared nurses to the organizations, retain them, because we know that the newly licensed registered nurses turnover rate is high, and we want to decrease that. We want to make sure that we're giving them the opportunities to make good decisions as a pre-licensure student so that they feel confident and competent when they go into that first job. The Preceptorship to Hire program started with our founding partner, Sarasota Memorial Healthcare System, because of our funding and the pilot. And because of the success that we've had over the last 3 semesters, we were able to expand this program to 2 other clinical partners. So our students this semester had the opportunity to select the Preceptorship to Hire program at 3 different hospital settings. And as we continue to grow, and I mentioned, what if a student doesn't want to go to a hospital setting, we're offering next semester our first outpatient and ambulatory care setting, which we're really excited about. So this just continues to grow because of the success. So then moving on to the Trailblazer externship program. If I can tell you a little bit about what we were experiencing with those final semester nursing students. They thought they knew what they wanted, and then they get into the environment and they say, oh, this is not what I thought it was. And you would think that by the time they're ready to graduate, they would understand a little bit more about what specific units are or what patient populations are, but they were really struggling with it. So we realized we need to get them before that final semester of nursing school. We need to get them earlier in the program. And so we developed the Trailblazer externship program. And you may say, externship program, what's innovation? What's innovative about that? We know externships, everybody can offer externship programs. You earn money while you're learning and all is good there. But what's different about our externship program is that we're really, in addition to engaging the nursing students and learning under the direct supervision of a registered nurse, we're looking at developing them more professionally and letting them learn more about what a complex healthcare organization is, what the differences are within organizations or intra-organizations. So this externship program aligns with our curriculum, which our students are identified as level 1, level 2, level 3. Level 4 is that final year with their preceptorship program, but we're starting right at level 1, and we're offering externship information and content in their level 1 classes. So introducing them to what is a complex healthcare organization, really what is the difference between a for-profit and a not-for-profit organization, what's the difference between a community hospital, an academic medical center, all of the things that sometimes aren't taught in the textbooks. And we wonder, when are the students really going to learn it? Sometimes they're learning it during that first year as a registered nurse, so we have an opportunity to give them content like that ahead of time. So it's a voluntary program. However, anybody who is in level 1 involuntarily gets it, and that's not the right way to say that, but they're getting it because it's part of the curriculum right now and it's included in their course. So as long as they attend their course, they're getting the content, it's benefiting everybody. Once they move on from their level 1 courses into their level 2 courses, they can decide that point if they want to become employed in one of our partner hospitals for the externship. So that part is completely voluntary. If they wanted to be employed, perfect, we'll help match them and get that set up. And if they don't want to, they don't have to at all. Once they're employed in the organizations, we want them, in addition to doing their shifts under the supervision of a registered nurse, we want them participating in some of the shared governance committees or nurse practice committees, things like that, to really show them the role of the nurse in the complex healthcare organization. So that's what's making our externship program unique. Still focusing on students and looking at innovations that are helping them with their well-being and helping them as we're bringing them into our workforce. We offer a pre-licensure mentorship program, and we started this just this summer in June was our first go-around with it. And this pre-licensure mentorship program is not probably, when you think of mentorship, you think 1-to-1 or 1-to-2 ratio with a mentor in the organization or somebody I could go to and ask. This is different. This is based on the work of Dr. Lena Gould, who does diversity for CRNAs, and how she mentors CRNA students is such that she puts them in a group setting. And her intent is to increase diversity of the CRNA workforce, and she's published on it. And she has an immersion model. And so I was reading her work, and then we were fortunate enough to have her at the University of South Florida as a visiting professor the last year. So I was like, how can I selfishly take all of your expertise and all of the things that you do for mentoring diverse CRNA students and put them into the pre-licensure, put that content into the pre-licensure program? What can we do for our pre-licensure students? So the way that we do the pre-licensure mentorship program, it was really fun. We had a classroom that was about this size, and we invited a panel of nurses from one of our partner organizations. And the panel of nurses, it was very purposeful in who was there. So we had new nurses up through nurse managers, somebody who had been in the organization for 30 years. But we also had a diverse panel. So the people who were invited were purposely invited to make sure that there was representation on the panel, and people in the audience would say, I can identify with that person. So we did have a diverse panel. It was a 1-hour session. We started the session with presenting the organization. So what were the core values of the organization? Learn a little bit about the organization, learn about the residency program. So if they wanted to be employed at the organization, what that would entail. But then the second half was a question answer with the panel. And that was the most valuable because the students asked a wide range of questions. It was our first one, so to be honest, I wasn't sure if they would be brave enough to ask, so I had my own questions that I was going to be like a conversation starter, but I didn't need to, and it was fantastic. So they really learned about what it's like to transition into the role of the nurse. What are the nurses doing in the organization? What do different things mean? Their questions were answered. And so they were mentored, although in a group setting. So not like your traditional, this is going to be my mentor while I'm in the program. So we're going to offer this 3 times per year with different organizations and on different campuses each time. And the last program that I would like to introduce to you all is what we call SHINE. So we are piloting our SHINE program, again, to test feasibility and acceptability. And this SHINE program, strategies for a healthy impact in nurse empowerment. And this is focusing only on registered nurses. Right now we are piloting in 2 different hospitals in the Tampa Bay region. This is not for our students. Going back to thinking about what nurses need to be well in their environment. And we know that health and wellness can be an individual responsibility, absolutely. So I know I should get enough sleep. I know I should eat my fruits and vegetables, like I know. However, It's also, in addition to the individual's responsibility, it's the organization's responsibility to be able to provide an environment which allows the healthcare workers and the nurses to be healthy. An organization's responsibility to provide the opportunity and the environment for nurses to flourish and to thrive in their jobs. And so what we're looking at with our SHINE program is exactly that. We're offering the opportunity for the organization to give nurses protective time where they can focus on learning empowerment skills and advocacy skills for themselves, skills that will translate in personal and professional lives. So our goals here are to increase confidence, increase the effectiveness of their skills, ultimately decrease burnout. And if we even take it a step back further, all of these programs are being developed and being tested and implemented because we want to be able to correct that imbalance of the supply and the demand of our nursing workforce. We want to be able to make sure that we're going to have healthy, highly educated nurses that will be able to impact the care of our communities, impact the health and wellness. So our next steps, what are we going to do? Well, we're going to continue our work of building academic practice partnerships, and this is a big piece of the statute for the Florida Center for Nursing for this coming fiscal year, is to encourage and build academic practice partnerships, looking at how we can truly work together with sharing our resources because we have a shared vision and shared goals, and creating healthy work environments. Like I said, it's an individual's responsibility for maintaining a state of health and wellness, but it's the organization's responsibility to be able to provide that healthy environment which the nurse or healthcare worker can flourish and thrive. So that leaves us 5 minutes for questions and answers, and I hope that if anybody had questions or answers, you won't be shy and you'll let me know. However, if you think of a question later and you didn't get a chance to ask it now, you can absolutely connect with me on LinkedIn, follow me on Twitter, send me an email. If your question is directly related to the Office of Wires from the College of Nursing or the Florida Center for Nursing, the information and the social media is on there for you too. So you know how to get your questions answered, I hope. And I think that's it, Mike.
Okay.
Can we open it for questions if anybody had any?
Yeah, please.
Will you use the microphone so that it gets caught in the recording, please?
Sure, I can block that.
Oh, okay.
Will you? Thank you.
My name is Hugh Guy, and I work for Discovery Senior Living. And I came to this session because my daughter will be finishing up her last segment in RN school this year, and super proud of her. And she talks about this even as a student, and I'm thrilled to see what's going on, and I'm selfishly attending on her behalf, and I'll be happy to go back and say, you know, here's some great things that are going on. So just wanted to thank you for having this presentation. It's comforting to know that things are being done to support the people who run the business. Thank you.
Yes. Thank you for sharing that. And thank you for attending the session, because even if you're not a nurse or don't have a direct relationship with a nurse, or maybe you're not the primary nursing employer, it's still important to understand, and just like the goals of the National Academy of Medicine's collaborative on clinician well-being is to make sure that we're increasing awareness and people understand what's happening, because it's going to impact all of us someday when we need health care. So thank you for attending.
I want to make sure there's nurses out there to take care of me when I need it, and I'm old.
Yes, she just said she wants to make sure that there are nurses that will take care of her when she needs them. And you know, that was, I probably won't be speaking out of term if I tell you a little bit about the philanthropic support that we received for that first program that we put together with the Office of Wires, that Frontline Nursing Continuing Education Program. It was at a time that we developed that, it very much was that there was not enough PPE in a lot of institutions. Nurses were afraid nurses were exposed to and contracting COVID-19 at higher rates than other people. And we did have a philanthropist fund that because he wanted to make sure that there would be nurses that would be around to help take care of him if he needed that. And what could USF do to help this situation? And that's what started all of this, was that this is what we could do. We could definitely help our community.
Any other questions?